Hello, my name is Dr. Amelia Franck Meyer, and I'm pleased to be talking with you today about building a new way together, which is how we refer to the collective effort that will be required to transform child welfare. We believe it will take all of us working together to make this happen. I'm the CEO of Alia. Alia is a nonprofit organization located in Minnesota in the US. We work all over our country with leaders who are interested in transforming their child welfare systems, and also work with a few friends internationally as well. So the work that we're up to at Alia is really around considering our purpose in child welfare. The US child welfare system was really set up on the concept of rescuing children from bad people. Bad parents. And instead, we are now really fundamentally rethinking our purpose away from rescuing children after things had already happened to them, after they had already experienced abuse or neglect, and instead thinking about a mindset of community support and prevention to work with families to strengthen them so that children don't experience abuse and neglect. So really fundamentally rethinking our purpose in child welfare away from how do we keep children safely from their families to how do we keep them safely with their families. So really thinking about this again, how do we keep children safely with their families, not from their families? And this means that in order to do that, we must really shift our lens, shift our focus away from really having a child-only centered approach to intervention, where we remove a child from their family, from their community, and provide all of the services or interventions with that child only. And instead thinking about how do we strengthen the family system so that parents or families are able to safely parent their children. And this requires a very fundamental shift in our thinking, as well as a fundamental shift in the ways in which we work with families in order to keep children safe. As we think about this new lens of how do we keep children safely with, not from their families, we begin to ask new questions in our work. And so we're asking questions like, what would it take to keep every child safely at home? And if they couldn't stay safely at home with their parents, could they stay safely within their own family? So we used to talk about out-of-home care, being foster care or residential care, or care of a child outside of their parents' home. And we were really trying to avoid that. And knowing that sometimes parents aren't able to immediately keep children safe, we really shifted our language to think about how can we work with families so that children don't have to leave their family. Maybe they have to leave their parents' home temporarily, but could we keep them within their family? So what would it take to keep every child safely at home or safely within their own family, extended family? Or again, what would it take to help families who are struggling? So we deeply believe and have proven it through interventions we've done and outcomes we've achieved that it is possible. So we're really not asking, is it possible to keep children safely within their family? Or is it possible to help families who are struggling? Instead, we're saying it is possible. It is. Are we willing to invest what it would take to make that happen? Are we willing to take the risk that it would take to make that happen? Are we willing to change our practices, our funding, our thinking, our mindsets? Are we willing to shift those things to make it safely possible? And those are the new hard questions we are asking as we continue to think about this work in new kinds of ways. We are also encouraging the workforce to really begin asking these questions at the first indication that a child needs our help or support to stay safe. Really coming to the table with questions of what would it take? Assuming that all of our goal is to keep the family safely together, what would it take to make that so? And so that's a new question that we have been asking in the ways in which we've been working. Another new piece that we really need to consider differently is our roles. Really, when we're talking about keeping children safely within their families, we're also talking about simultaneously helping parents to safely parent. So this means in our current system in the US, if a child's not safe, we often remove that child and place them out of the home. There has been a strong push to keep those children within their extended family. So we would call that kinship placement or placement with people who are related. But in our current way of work, as we place children with kin, we often disregard the parents. It's really up to them to do the work that they need to do in order to become safe placements for their children again. We might give them referrals to different service providers, but really there's a large amount of blaming and shaming and punishing and disconnecting parents as we remove their children. And then again, we focus only on the children in those alternative placements. And what we're talking about in this new way of work is that we would try to keep children safely within their families. So even if their parents couldn't keep them safe, we would move them out into family homes, but we don't then disregard the parents. We are simultaneously working just as hard with the parents to ensure that they are getting the help and support they need to be able to safely parent. So what are we doing with the parents to ensure that they are able to find housing, to find employment, to treat their alcohol or other drug addictions, or to get the help they need to heal their trauma from when they were children in order to allow them to safely parent their own children. And so this is a new way of looking at it. We're no longer removing and rescuing children, but we're keeping children safe within their family and keeping them connected in whenever possible with their parents, while we're helping parents to get the help and supports that they need in order to safely parent. We at Alia have conducted a research brief analyzing the current research about removals of children from their family homes. So there's a strong bias against parents who have neglected or harmed their children. So we have kind of a approach in the States where they don't deserve their children, right? And so we wanted to really conduct a research analysis to say, is it better for children to remain with their families? And in fact, that's what the literature said. The research brief showed that for children who have experienced maltreatment, so just to be clear, they have been abused. For those children even, out-of-home placement provides no or little measurable benefit in terms of cognitive or language outcomes, academic achievement, mental or behavioral risk, or suicide risk. So what we know is there is a compelling amount of evidence in the literature that is in support of keeping families together and avoiding family separation whenever possible. And we believe with a different approach where we also support parents, not just children, that we can make it safely possible more often than not. This research brief is called Evidence-Based for Avoiding Separation, Family Separation and Child Welfare. It is available free for download at our website at aliainnovations.org. We also like to look at our problems in new ways. We believe we're solving the wrong problems. So in child welfare, we often talk about we don't have substitute caregivers to care for these children. When we remove them from their homes, we're looking for foster parents or substitute caregivers to take care of them, and we run short on supply of those folks. And so kids end up getting placed in more restrictive settings or residential settings in an effort to remove them from the family and keep them safe. And we at Alia really believe that we are looking at our problems in ways that are considering them supply problems. And might we think about them as demand problems? So instead of saying we don't have enough of a supply of foster homes to remove the children and place the children in, what if we said we have a demand problem, which is to say we have too many children who cannot live safely at home with their parents. And so that's where we should be targeting our resources and efforts and interventions. We should be helping more families to be able to safely parent not spending our resources, energy, and efforts in trying to recruit people unknown to the child or unrelated to the child to care for them. Rather, we should be working towards trying to make families safe for their own children. This is another one of my favorite sayings that I think exemplifies what we're trying to do in child welfare right now. We're not really thinking about doing things a little bit differently or a little bit better or continuing on our current path, but maybe doing it faster or maybe doing it with less resource. What we're talking about is doing something very different, fundamentally different. And this saying, the electric light did not come from the continuous improvement of candles, is one of my favorites. So we can have a better and better and better candle, and you still have a candle. And then if we look at the invention of light bulbs, that changed everything, right? It was a disruption. And so we're really looking for things that radically shift what we've been doing, that removing children from their families, kind of forgetting about the families and focusing on building new or more or different or families unrelated to the child has really not been delivering the desired outcomes for us. So our innovations really need to be focused on doing something radically different, and helping parents to safely parent is a very different approach from rescuing children from, and I'll put it in quotes here, bad people, as we have thought historically. Because we know that that is not producing the desired outcomes. What we've learned from the research is that what every child all over the globe needs more than anything else is for their parents to be okay and to be able to keep them safe. And so our efforts must go to this goal. We came together with a group of 100 innovators from around the US to say, what is our current way of work and what should the new work look like? We've called this new way of work an unsystem, not the unsystem, because it's not one way, it's not one model. And we don't know what the new way of work might be called in the future. But for now, we know it's not this system, it's an unsystem. So when we look at our traditional child welfare system, it's really been constructed in ways that undermine family bonds, that undermine the family system by blaming, shaming, and punishing parents when they are not able to keep their children safe and disconnecting families. And what these innovators, after coming together for 4 days of designing to answer the question, how might we build a better child welfare system? What they said is we should build an unsystem. And that would be one that strengthens family bonds, that is focused on family well-being and healthy child development. And what we know from the research is that what children need to develop in healthy ways is a secure connection to a protector, preferably their own mother or father, but definitely a single protector. And so what they said to us is we should put the whole family at the center. We should focus on building resilience and joy and well-being and health in family systems. We should use locally delivered resources that are immediately available when families need them. We should have supportive, consistent connections, not a worker for this, a social worker for that, another one for this, but one person who stands by you and says, I will get you through to the other side. I will help you to feel better. They should be family-driven, meaning families decide what they need, culturally specific so that families can connect in culturally appropriate ways. And we would value and build rather than disconnect family ties, using natural community support, so people in their community to help them strengthen. They gave us these guiding principles to let us know if we were on the right track. These are: protect relational connections as sacred, which means that we do not disrupt family bonds unless it is absolutely necessary. Rather, we do whatever it takes to keep families safely together. We nurture the capacity for joy, not just in our children and families, but in the people doing the work. Helping people should be a joyful experience and should not disrupt our ability to parent and partner well either, or our health. So helping people, when we do it in the right ways, should bring us joy. Insisting on racial equity and radical inclusion. So we really take an anti-racist approach, believing that the disproportionate outcomes for families and children of color is largely based on implicit, explicit, and systemic bias and racism built into our current way of work in child welfare. So really taking a lens of ensuring that we are anti-racist in our work. Daring to Share Power is really around helping children and families to design their work by sharing power with them. They might run the meetings. They would have a say in which family member might be best positioned to take care of their child. And sharing power with one another, with other organizations and other teams, so that we all work together to benefit the children and families. Committing to intergenerational well-being. This is really about the idea that we don't just serve or treat children, that we must take care of their children when possible, if that's part of the equation, or their parents or grandparents, their siblings, that we're really looking at the whole family, intergenerationally. We know that trauma is passed forward 7 generations, and so we have to take an intergenerational approach to this work. Another guiding principle is to trust the wisdom of children and families to design their own futures. And this means that we talk to them about what they need. We talk to them about their hopes and dreams. And they are at the table designing their futures, and we are at the table to support them in making that happen. And finally, our last guiding principle is do what love would do. That means if you're not sure what to do, you do what you would do for someone you love. You do what you would do for your own child or a child you loved. We are about to release within the next couple of weeks, so sometime near the end of January 2020 or beginning of February, a guide on building an system. We have worked with a cohort of innovative child welfare leaders for the last year plus, and their outcomes are documented in this guide, as well as their failures and ways to build this new way of work. This will also be free on the website for download. An early release of that, in the beginning parts of it, explaining how we ran that cohort, is called the Alia System Innovation Cohort, Case Studies and Early Data. This is immediately available on our website to learn more about that cohort. The top 5 things we've learned from the cohort are: 1, prepare and take care of yourself and your team. This means that when people are exhausted, burned out, or otherwise experiencing secondary traumatic stress, they don't show up as their best self. And so we really need to take care of ourselves and the people doing the work in order to be able to show up in ways that are warm and empathetic and to do whatever it takes on behalf of families and children. Number 2, think differently about the work. We're not just doing what we've always done a little bit better, but really thinking, who are the non-traditional folks at the table? Who might help us to do this work very differently? We might engage different ways of work. For example, we wanted to reunify a grandma and her grandson, but the grandson was getting into his early 20s and didn't want to live with his grandma, even though he wanted to be deeply connected. So we built a tiny house, a small house in her backyard, so they could be together, but not have to live together. He had his own independence. So what are different ways to think about this work? A key thing we've learned is to make the old ways harder and the new ways easier. So if you want people to stop doing something, put up barriers. Have them get several levels of approval, or have leaders be at the table, and so they will be sure that they are well prepared if they have to invite other people, or that they avoid doing those things if it takes many steps. Take a bet on families. What this really means is we want you to support family togetherness and to take new kinds of risk in conjunction with them to make it happen, and then expand the group of helpers. So different roles within your own agency or organization, as well as different partners, non-traditional partners. We're partnering with public health, we're partnering with schools, we're partnering with the police in new ways to help keep families safely together. Some of our obstacles were having everybody measure the same thing in the same way and capturing that accurate and meaningful data. Really getting people to focus on race equity, especially in communities where there's not a lot of diversity, to still help their staff to see the diversity in their communities and to work in racially equitable ways. To include family and youth voice at the table has been challenging, yet something we continue to pursue. And there have, in many communities, been a lack of community resources, so we've had to help people to reimagine ways that they might serve their community. And of course, community pushback. People want to do what they've always done in the ways they've always done it until they understand why it's important to change. And when we know better, we do better. And that's what I wanted to share with you today. I have a TEDx talk on the human need for belonging, which outlines some of the reasons why we're doing work in this new way. We are connected in social media, and we would just really love for you to stay connected or to contact us with any questions that you have about the work we're doing. All of the resources we have are on our website, which is listed here at aliainnovations.org, and are free for download, and we'd encourage you to do that. Thank you so much.